Good morning again. We have the most awesome panel ever assembled at a joint K-12 behavioral health conference in North Dakota right here. And of course, we've had fantastic keynotes this morning from Dr. Ablon and from Pam Sagness. Thank you, Doctor. Thank you, Pam. Setting the table. We're joined by Russ Riehl and Senator Judy Lee. Russ is the middle school principal at Simle. This is one of the places we're doing a pilot project related to behavioral health. You and your whole team are going to have your own panel this afternoon, but you're going to join us this morning to help talk about how we're taking all these concepts, driving them down into the school. And of course, I think everybody in the room knows Senator Judy Lee, been named one of the most effective legislators in the nation. Along with her and the other legislators that are here today, we've got more here today. Thank you all for being here. But as the chairman of the Senate Human Services Committee, is one of the leaders behind all the successes that Pam just got done reiterating, one of the most successful sessions ever. And of course, Judy's been a champion of behavioral health issues for her entire time that she's been in the legislature. So great to have you here. And we're going to hear from those two first, and then we're going to go back to our keynoters. But Russ, we're going to kick it off with you. We talked new approaches with Dr. Ablon. We talked all the things that are happening at the state. Tell us, for all the educators in the room, give us the highlight of what's happening at Simle and how are you putting this to work on the ground with your team and with the students.
Okay, great. Thanks, Governor, and thanks for having me here this morning. We, at our school, and you'll hear more from our staff later this afternoon, but we really embarked on a journey 4 years ago in our school. And it really, kind of stemmed around behaviors. It stemmed around needs to do a better job of taking care of our staff, but ultimately really being reflective and being able to look at your data, look at your practices to see what's working and what isn't working. And I go back and I think to where we were 5 years ago in our school, and we just kind of kept making many of the same mistakes over and over just because we didn't know any better. We had an opportunity to learn and to grow together as a staff. And one of the things that we did, and I think it's so appropriate for this group here today, is this just isn't about administrators. This is about teachers. This is about counselors, support staff, bus drivers, kitchen staff, your parents. Everybody has to engage in this work. And without capacity and teacher leadership in our building, I wouldn't be sitting up here today. I absolutely would not. Everybody knew that there was a need, and there was also a yearning to learn. And our assistant principals, our counselors, our teacher leaders, they actually took it upon themselves to start having those conversations, and they're tough conversations because you have to be vulnerable. You have to admit that your practices are archaic, they're not working, they're ineffective. So one of the first things we started to do was data. We had to collect better data, and we had to analyze that data and put the data to use. And in doing that, and we'll share some of that data with you this afternoon, but we saw significant decreases of office referrals. We saw significant decreases in police citations, and we'll talk about that later as well. But really, it really became a shift of not talking about consequences, but talking about interventions. What can we do for our kids? Keeping kids in school with us, with their teachers, those people they have relationships with. And I think that's the one thing I hope we all leave today is it's all about relationships. And the relationships that our teachers develop and cultivate with their kids, but also the relationships we have with each other as a staff and how we can work together and problem solve and do what's best for these kids. So we have a grant that we were awarded last fall from the Department of Human Services Behavioral Health Division. And one of the things we set out to do was to do a couple of things. Number one, we didn't want to develop a model just specifically for Simle. We wanted a model that would work in large schools, small schools, urban schools, and rural schools. And that's really what we have embarked to do. And I think we have worked through some efficiencies. We have developed some outstanding partnerships with Pam and her staff. We are working with Sanford Health in our school. Sanford will have a presence in our school, a clinician in our school, working with them. But we're also going to learn from them on how to work with some of these tough kids and some of these kids, but keeping those kids with families in our community and working from there. So I hope by the time we end today, you'll have an opportunity to get some names, some contacts, some faces, so you can go back to your schools and your districts and have someone to reach out to talk to learn with, so you don't have to do this alone.
Russ, fantastic at what you guys are all doing, you and your team, on interventions versus consequences and really leading the way. Pam had a slide up with the acronym with we call it MITS, MTSS, versus continuum care. You have a multi-tiered system of support. Maybe just give, what does that mean to you and your team?
Yeah, what that means to our team is it's really all of our kids are tier 1 kids. All of our kids have a lot of development just starting at this early adolescent age. So whether it's kids learning how to persevere, how to build relationships, how to repair relationships, whatever the case might be, but really treating all of our kids as tier 1 kids. And then you have your tier 2 kids who will need more intense interventions, but you know, those kids that are very, they have a lot of great qualities going for them, but they have some bumps in the road. Could be change in family placement. It could be some trauma things going on at home or whatever. And then we have our tier 3 kids, and I think that's why a lot of us are here today. What do we do with these tier 3 kids? What do we do with these kids that, you know, we just don't have the supports? We didn't go into this work. I've said that line many times. I didn't become an educator or an administrator knowing all I need to know about behavioral health, but I've learned I don't have to know all of that. There are resources out there. And so when we went and looked for someone to partner with to come into our school and offer behavioral health services, I remember having the conversation with Dr. LeBeau and just simply saying that, you know, we have our tiers of intervention, but now we need that chimney. And that chimney are for those kids, those you know, 6, 8, 10 kids in our school that we've just exhausted all of our interventions. How do we help those kids? And even more importantly, how do we help those families?
Chairman Lee, again, congratulations. Thank you for your leadership. What a great session you had, getting so many things moved forward, as Pam enumerated. On that list, is there anything that stands out for you that is something you've been, you know, working on for a long time, finally got it through and you feel great about? And then also in the interim, I know you're already digging in for next year on stuff. So what feels great about what you got accomplished, and what's on your plate for the highest priority going forward?
Thank you, Governor. It was a really good session. It isn't that it all sailed through easily all the way, but I think it's really important that you know how much credit has to be given to Pam Sagness and to the Director of the Department of Human Services, Chris Jones. Pam is a gift to North Dakota in so many ways, with her passion for this subject and for her expertise and her way of showing legislators in such a credible way how things can be improved. If we didn't have that kind of leadership coming from the executive branch to help educate the people in the legislative branch, along with the other sources that we have, don't believe, and the governor would be happy to verify this, it isn't that we do everything that the executive branch thinks we ought to do, but we really do appreciate credible people coming to tell us what we might need to know from lots of different perspectives. And Pam has done a wonderful job of helping us to the point that I think perhaps Pam and the governor might agree that this was a session in which there was no real legislative pushback to any of this at all. Everybody is experiencing challenges in their schools as well as in the community at large with behavioral health, both mental health and substance use disorders. And I'm sure you already heard during this day and yesterday, the behavioral health umbrella is over the top of mental health and behavioral health. And some individuals, children or adults, will have both of those diagnoses. But we have those challenges in our schools, and I don't think you should have to get hazardous duty pay for being there. I think your job is to educate. And that is what we need to do. The whole idea of least restrictive environments, the court ruling that talks about that affects us not only in schools, but in the state hospital, in the penitentiary, in jails, everywhere. And I understand totally the importance of recognizing the rights of the individual, but I also think it's really important we not ignore the rights of other people involved. I have had parents of traditional learners tell me that one of the children that that comes to mind, is an early elementary student and had gone to try to break up something with a child with regular issues in the classroom. And he really had some nasty facial injuries. And so this father was really ticked off, and I don't blame him. He said, my kid shouldn't have to go through that. You know, he's there to learn. So finding a balance between how we deal with the children who have behavioral issues that need to be managed, and how we respect the rights of the traditional learner to learn also, is a really big challenge. Somebody smarter than I am about all of this stuff mentioned, as a part of our task force meetings that we had in Southeast North Dakota last fall, wasn't it? Time flies. Almost a year ago, said, what is the bigger challenge for this student? Is the behavioral issue the bigger challenge in learning, or is the intellectual capability of that student the biggest challenge in learning? If it is behavior, then let's deal with the behavior and bring the education to the place. If it's intellectual abilities, that's a different kind of setup, and you can deal with those lesser behavioral issues in a traditional setting. We've had a lot of discussion in that task force in Southeast North Dakota about this, and I am extremely aware of the passion and caring that the advocates and the parents have for the children who are at level D. I'm talking level D now. And in visiting last week with a member of, excuse me, the overall governing, I'm not going to say if it's school board or administration, of one of our two largest districts, the point that was made to me is that the number of children they're talking about is 0.5% of their special education population, not 0.5% of the school population. So we're talking about a small number of children who are at that level D, and how do we handle that? So we had an interesting a little video about a wonderful school in the Twin Cities area that deals with some of these kids that are learning to manage their own behaviors. And at the same time, they're having instruction brought to them. And instead of being a place that they're sentenced to, we have to change our own attitudes about it being a place they get to go to. Because not every kid, as you know, learns in the same way. We've accepted alternative high schools for years as a place for those students who haven't thrived in a traditional high school, but may do better with block programming, whatever it takes to make sure that that student gets their high school diploma. We maybe need to think about it. I'm not the expert here. I'm surrounded by other people who are, and that includes all of you. Maybe what we need to really get serious about is what we might do for those children in a smaller setting. I'm real proud of one that the West Fargo School District has with counselors and a psychologist and therapists that are there that have small classrooms. And if you're in West Fargo and you haven't been there lately, I would invite you to talk to the administrators there. I'm sure they'd be happy to give you a tour of our center that deals with those kids, which also has an on-site childcare run by the YMCA. Which is separate from it. Anyway, it's really cool. So you ought to check it out sometime. But we need to think about how we're going to do that. A lady who cuts my hair said that her grandchild, who was a third grader a year ago in public school, in his classroom was one child who melted down regularly 3 times a day. And so that means, of course, the rest of the class leaves the classroom and goes to the lunchroom or the playground or wherever, another third grade classroom, and until the child is allowed to settle down. I understand from the treatment side, that's the thing to do. But I also think that that has disrupted the education of those other kids. They put him in private school, and it's a financial sacrifice for that family, but they felt it was important. We can't let it get to that. So please be a part of the solutions that we have here. I think the behavioral resource coordinators, did I do it right? I know what it is. I am so excited about being able to establish that in every school, in every district. Whether you're large or small, or urban or rural, as was mentioned earlier, we have a need for that. And it doesn't mean that that coordinator is going to be the behavioral health expert, but it means they're going to be connected to somebody who is and can provide help. When we started this several years ago, we chatted in the Human Services Committee often about it not just being the teachers or the principal to whom someone gets sent, but the lunch lady and the bus driver, as you mentioned. Several of us who are public officials in West Fargo were invited to serve hot lunch several months ago in our local schools, and I was at Eastwood Elementary, which happens to be the school my children attended. And there's a really great guy there, an African American who is on the custodial staff. And kids just gravitate to this fellow. In the first place, there's a very large percentage of ethnically diverse children in this school, which is great. But one little boy came running up to him and gave him a big hug around his leg, and the custodian's chatting with this little boy, and everything is going well. And that custodian is more important to that kid than probably lots of the other people who are also doing good things for that student in that classroom. It may be that the bus driver is the one who sees acting out on the buses. Or it may be that the bus driver is somebody that the student knows a little bit and confides in. They have to know how to connect that student and his or her family with those experts too. So that's more anecdotal, I realize, for you than it is talking about what all we did in the legislative session, but I know that you've already had some of that, and if there's anything further that I can add later, I'll look forward to the opportunity to do that.
Thank you, Senator Lee, and thanks for being so engaged in the local school district too. It's great you got that hands-on frontline experience.
We don't have the answers yet, but I can tell you that the school districts, that Fargo and West Fargo, are working closely together on what to do for these level D students who really need us. And there are some things that they're exploring as far as additions. Please don't think decisions have been made. I'll be in big trouble when I get home. But they're exploring whether or not additions to existing schools might be a place where they could provide short-term services for these children before they would move back into traditional classrooms. And they're continuing to work with IEPs in handling the challenges that these students have. So, but we're all in the same boat. I don't care if you've got 30 kids in your school or 11,000 like I do.
Dr. Ablon, again, thank you this morning for informative, inspirational, mind-expanding, or maybe I need to say cortex-opening talk that you gave this morning, but fantastic. Thanks for coming back to North Dakota. One of the things that you didn't touch on, but I know is related to your work, you mentioned Dr. Bruce Perry from North Dakota with the work he's doing on trauma. You had the slide up that showed, healthy toddler brains versus trauma-exposed toddler brains. Addiction, it's a huge issue. We know it's reaching down into our junior highs and high schools. We know that kids that are in elementary school have parents that are dealing with the disease of addiction. Tell us about the intersection of your work, the brain science, and the disease of addiction, and where these all intersect in behaviors that may be coming out in school.
Sure, it's a great question. I think when you look at the history of understanding addiction and substance use disorders and resulting treatment, it actually bears a fair amount of similarity to the things I was talking about when it comes to kids with behavioral challenges. It was really not long ago that people viewed substance use disorders as a lack of willpower and discipline, really. And thankfully, we, I think, have come a long way to a more accurate, humane, compassionate understanding. But now, of course, it's also, okay, so how do you translate that into effective interventions? And we've applied our work in residential facilities, for instance, that work with folks who struggle with substance use disorders. And the way we conceptualize it is, again, a lack of skill, not a lack of will. And in many cases, what you see is folks who struggle with substances are using substances to regulate their emotions and to regulate themselves in general. And if they had skills in more abundance to do that absent the substance, they might be able to resist the substance use more effectively. Obviously, there's complicated biology and addiction at play as well, but we think that there's some similarities there. And one of the things I didn't get to say earlier this morning is when we look at mental health as a whole, we have a long history of completely misunderstanding problems and blaming people for them, where we later learn we were totally off base. And in my area, when it comes to behavior, you look at child psychology, child psychiatry, we've been blaming parents, for instance, forever, or more accurately, blaming mothers forever, for everything from schizophrenia to autism to behavioral challenges. And we also blame the individuals themselves. And I think that that's the biggest shift that has to happen if we're going to effectively help folks who struggle with substance use disorders, is to stop the blame game and to really introduce compassion and empathy and understanding, and also partnering to find out what the most effective treatment's going to be.
You mentioned something that's been broader part of your work and working with youth with autism. We know that one of the health issues in schools this last year was the United States should have the highest health outcomes in the world, and yet we had outbreaks of diseases that were perhaps almost eradicated because people are resisting vaccinations. Is this any part of your work that you've uncovered that would cause people to think that we should have a different approach?
Yeah, no, it hasn't really intersected with my work particularly. Obviously, there's been a lot of conversation about whether vaccinations and autism have a link, but really that's been clearly debunked at this point. But no, I wouldn't say that that's been necessarily a big part of our work. I just, talking about autism in particular, just to reflect a little bit more, we used to think it was cold, unempathic mothering that caused autism. And I'm not talking back in the dark ages. I mean, we had this notion of the refrigerator mother. It was literally in the last 20 years, we thought refrigerator moms caused autism. And I just use this as an example to say, fast forward 20 years and we realize we're completely and totally wrong. And now we're understanding things better, but really just trying to figure out most effective interventions now that we understand things better. So I think you and I talked about this at the break a little bit. We have to approach this work, these problems, with humility and realize that we have a long history of being absolutely dead wrong and treating things based upon dead wrong assumptions. We've got to be open-minded to completely rethinking what these things are about, and as a result, what our responses are as a community.
So you're really saying part of our growth is we have to have the humility to understand what we have to unlearn before we can start learning.
Absolutely. I mean, I find one of the things I like best is working with folks, teachers, for instance, in their training, so that we don't have to unteach things they've learned when it comes to classroom management strategies that backfire for the most challenging kids. I think I love hearing about all the innovative programs and opportunities that are being built. What I say to myself is we've got to pay attention to what people are doing in those programs, whether they're housed in our school, whether they're housed somewhere else. If we're still using conventional approaches, flowing from conventional wisdom that has been disproven, it doesn't matter how many new opportunities we create, it's not going to work. And so sort of what we're teaching people to do is got to be high on our list in terms of our focus.
Fantastic. Pam, thank you for your leadership, for your work. As Senator Lee said, a key part of driving all this forward. You gave a great primer this morning on everything that's accomplished, but coming from all of this, I know you've always got new ideas about new programs, rolling things out statewide, the collaboration that we're really seeing here today between behavioral health and our K-12, two giant budgets. We spend about $4 billion over 2 years on human services. We spend about $2 billion on K-12. So these are two of the three largest budgets in the state of North Dakota. We have an opportunity to collaborate here, each doing what they do best to better solutions for our students, better solutions for taxpayers. But Pam, so what's next? Tell us about some of the rollout, next steps, ideas you have.
Absolutely. So I mentioned earlier the Behavioral Health Resource Coordinator. So one of the first things we're doing is putting together a 12-month plan of all of the resources and information and everything from webinars to connections to local service providers that we can provide to schools. Because it really is difficult to navigate what you need in a system. We struggle within the behavioral health system to navigate it. So when we're struggling ourselves, it only makes sense that if you're in the education world to be able to figure out what's the right point of contact. So part of what we're trying to develop with that system of care is a no wrong door. So that no matter who you call, there's someone that can connect you. One of the things we've identified that's been a barrier in our state is that everybody has a beginning and an end. I'm a clinician. I do this and this between these hours. But whether or not you have housing, I don't do that. And then we have people who do supported housing, and they say, I'm here to help you get housed, but I can't help you keep the housing by offering case management and coordination and services. And so what we're really doing is looking at how we can have a system where there is no beginning and end, and no matter where you enter, you can connect to all of those services. And we have real innovators in the state of North Dakota who are doing phenomenal work at the local level. It's just not globalized or in a way that's really a systemic and sustainable model. And so I think the more we work on that, that's vital. And I just have to be honest, like, so when I get to the end of the slides and I talk about all the legislative things we do, I can't make a 1915I sexy. I'm just gonna say it. The 1915I and Medicaid state plans and all of those things, it's not a great talking point, but it truly is going to revolutionize the way that we provide services to kids and families. And I just have to keep saying that. And I don't know if we have to brand it some flashy jazz hands kind of like, you know, fun thing, but it is a really, really big deal. So I just want to keep driving that home. And if we can find a way, or if someone has a great idea of how we can make that something that's really meaningful, I'm completely open. Please email me. But it's going to change. We have right now services that are available for kids who have a developmental disability. That same child, but with a mental illness, does not get that service. And that's the part that we're changing in our system. So I mean, it's just the biggest deal, and I keep saying it over and over, and it's like, hey, this is a really big deal, and it's a really big change. It's going to change the way that we treat families. It's going to change the resources we have available for schools, and it's going to change the way that you interact with children. And I really appreciate, as Dr. Ablon said, every single one of the programs or every single one of the things that we're doing, they're not different. You know, people talk about being trauma-informed and person-centered, and then we're going to do this and that. Every single one of those things is exactly the same. It's all about how do we do what's right in the right way for the person who actually has the need. And we use a lot of terms and we put a lot of words on it, and then we're like, oh great, another government rollout. But the reality is, it's not a new thing. It's really about those daily interactions and building relationships and caring about people and having humility. And that's part of why I share some of my own experiences, because I've made those mistakes. I've been that counselor that kicked somebody out of treatment for the condition that put them in treatment, because I didn't know any better. And if I don't learn how to do that in a different way, I can't change. So thank you for this opportunity.
Not that we've rebranded it, but I'm only going to think of it as the jazz hands playing now on that thing. I can't remember. Yeah, that's right. Here we go. Russ, we've got policymakers here, national thought leaders, going back to what's on the ground. What's getting in the way of that you as an administrator and your team? What's getting in the way, and what have you learned in the work that you've done? You're ahead of some of the rest of the state. What have you learned that you would do differently if you had a do-over?
Well, those are some loaded questions, Governor. You know, right, I'll use myself as an example. I would say early on in this journey, I got in my own way, thinking it was working and not reaching out. You know, I think that's probably been the biggest aha. Whether it has been working with DHS, whether it's been working with our local school district, whether it's been working with policymakers, whether it's been working with Sanford or Lutheran Social Services or the United Way or the Midwest Dairy Council, all these people that we're partnering with in our school, everyone says yes. And I almost get the sense like, why is it taking you so long to get here? So don't be afraid to think big and to think systems with this. Policymakers, we appreciate the ear and the trust that you have put in us to do this work. You know, we really are working hard on our end to come back with some data to show what's working and what isn't working, so we don't keep doubling down on those same types of poor practices. So it really is, you know, leaders have to lead. I think that's really important. And the fun part in our school has been we're all learning this together, and we're all working through this together. It's not a he, a she, a me, or I. It's an us thing. It's a we thing, and that's the beauty of it. I mean, problem solving's hard work, but it's a lot easier and a lot more fulfilling if you're sitting around with people who all have that same goal, and that's helping these kids, helping our families. And it really has also changed how we hire. I want people, I've really changed my hiring practice to more of a dispositional hiring. I really want people that, number one, are relationship people and people who can be coached. I was so glad to see your slide earlier about the coaching. I think that is something that just gets undervalued in our state. We talk about academic coaching, but there's also coaching we need with these behaviors and some of the things that we're trying to not just learn about, but actually practice day in and day out in our classes. So I think our obstacles and our barriers, and I hope all of you leave today knowing that they're not, that I just don't see any glaring barriers right now. I think to have this day here, working with the Department of Public Instruction and Superintendent Baszler and the work that her staff does and the wanting to learn together and to collaborate is absolutely incredible.
I'm going to jump over to Dr. Ablon on this coaching point, picking up on what Russ was saying. On your slide, you showed we went from 0, people love the presentation, but no change occurs, up to 95% when you add the coaching. For all the folks here that are eager to do implementation, maybe just drill down on what do you mean by coaching?
Sure.
Who are the coaches? How do you train the coaches?
Sure.
How do you pay them, incent them, motivate them?
Well,
who are these people? I mean,
it's really interesting because when we talk about, I was talking earlier about helping kids develop skills. And by the way, whenever you talk about skill development, that's code for changing the brain. Whenever any of us evidences some new skill or behavior, you've created new connections in the brain, new neuronal pathways in the brain. And I talked a little bit about how we do that with kids, but it's not like it's different with adults. It's just harder because, principles of neuroplasticity suggest the adult brains are harder to change. But it's actually not the case that you can't change the adult brain. You can change the adult brain, but you have to follow the principles of neuroplasticity. And, that sounds fancy, but what does it mean? It means for adults to learn new skills, we need to practice in small doses over time that stress us, but not stress us too much. And we have to practice proximal to where that skill is to be displayed. So you can't take us out of a classroom and practice something in an auditorium and then expect people to move it back to the classroom. It's the same reason why social skills groups tend to be a massive failure with kids, because we take them out of social interactions, we put them together in a fake group and practice things in role play and send them back out, and they don't generalize. And because it violates principles of neuroplasticity. So what does this really mean? Coaching means that if you're teaching somebody something new to try in a setting like this, then you have to have them practice it in their classroom and get real-time feedback in small doses, and then they go out and tweak it a little and try it and come back again. Now, that coaching can take all kinds of different forms. Ideally, it's with somebody sitting there in the classroom with you. But what we've found, and others' research has found, is you can even do it from afar. We do it via video conference. But what it means is the teachers send us little videos of them interacting with students, and we review them, and we meet with them by video in groups, and we give them feedback. And they go out and they try something different, and they record it, and they come back in. That's how you practice. And that's literally how you change the brain and build new connections, new habits, new practices. But in the absence of regular practice with feedback and guidance in real-world settings, we're not going to make changes.
This is really, really helpful because I know I got up this morning, I said the last thing I want to do today is violate the principles of neuroplasticity, so I was really happy to hear that. But I'm with when you're taking a video, are we talking about a teacher with a student? A teacher with a student? Are they?
We are talking.
The student signs a form and says, "I'm willing to be videoed."
Yeah, absolutely. Everybody's got it. Everybody's got to get.
Or is this pretend role playing?
No, it's not pretend role playing. Because again, it's a funny joke. Yeah, but pretend role playing.
One guy laughed at my dad joke in the whole room. It's like
I thought it was
maybe
hysterical.
Somebody in the back chuckled,
right.
but you can't hear it up here. So I'm so happy at least one person's laughing.
I got a big kick out of it. But role play again, it violates what we know about how you change the brain. And let me be more specific. If we were to practice a role play of what I was teaching earlier, literally different neural networks will light up in your brain than if you're asked with a staff member of yours over a real problem you're having later to practice that same thing that we role play. Different neural networks will light up if we had you in the scanner. So what it means is, literally, if you want to change a neural network, you have to activate that actual neural network. So you have to practice in the actual situation. So if you're trying to get a teacher to do something with a kid, they need to practice it with the kid. Now, we use video, which we get consent for everybody. But if you don't have video, they can also share. This is what I did. This is how it went. This is what went wrong, et cetera. And it's not just the interaction. It's also how people think. So we coach, believe it or not, educators on how they think. How do we do that? Well, we have them use our assessment forms to actually assess kids and try on for size, identifying the skills that a student lacks, and see how they're doing that. And we can actually teach them to do it better by coaching them and having them go out and practice with more people. So.
And in industrial engineering, a very old principle called the Hawthorne Effect, which is when you're observing a behavior, it changes the behavior.
Yes.
Has there been a second order effect study of this when you're observing that? Is that?
We haven't studied it. I think that is true. I always joke with people when I'm asked to do a classroom observation because they've got, that one kid who's the toughest kid in the world. I spend the day watching the kid. The kids perfectly behave the whole day. You never quite know. But we find with video, I must say, that these days it affects the adults much more. Kids are so used to recording and being recorded, they couldn't care less. And adults, as we do it, we get sort of more used to it. But it's the only way to get really close to the interaction. I'm a child psychologist, and when I was trained to do therapy, I was thinking to myself, this is the weirdest field in the world, because somebody teaches you what to do, you go out and do it without anybody watching it, and then you come back and say, here's how I did it, and by the way, I omit all kinds of things, and then you tell me, based upon how I said I did that, here's what I should do again. Can you imagine in any other field? I mean, imagine if you were a carpenter and I would tell you what to do. You go out and do it without ever seeing anybody do it, come back and tell me how it went, and I would tell you what to do differently. It's ridiculous, right? So you have to get close to the practice is all I'm really saying, to observe it and to provide good coaching.
And can I add to that?
Please.
I think that's the principle, too, of talking about getting services in the community. So if we're talking about family skills, right, we're talking about children and really how they're going to be successful, not just in the education setting, but in the home. How do we get services so we can do that skill building and really work with families so that it's in the environment where it's meant to be? Because kids can leave home and go to treatment, and I said earlier, they go home, right? And we're not providing those support services and those things in that other environment.
Yeah, and if I can just comment on that for a moment. I think now that we've learned more about the brain, we realize that how flawed our mental health service delivery model is. Because as I mentioned quickly earlier, the brain, it doesn't change at 4 o'clock on Tuesdays for 45 minutes. That's not how you change the brain. And so the answer to helping people build skills is finding the people who are with the kid the majority of the day and helping them to be the agent of change. And we've long thought that that's parents, which it is, but the interesting thing I always tell people is kids actually spend the majority of their waking hours, the majority of their youth in school, not at home. Because most of the time at home, the majority of the time they're sleeping, actually. So it's at school, where we have trained professionals. Wow, what an opportunity for what we call a sort of therapeutic web around a kid to provide these little doses.
Russ?
One thing I would add to that is one of the things that we do in our school, when we have a tough kid that we're really struggling with, the first question that's asked is, who has the relationship with this kid? Who has the relationship? It might be an 8th grader, and it may be a 7th grade teacher that they had last year. It may be a basketball coach they had the year earlier, but who has the relationship with that kid? We can go so much quicker, so much further, so much sooner with that type of setting. And that's why I can't emphasize enough the relationships that our classroom teachers have day in and day out and cultivate with these kids. You can't put a monetary value on that.
It's interesting. I think sometimes when we talk about relationships, I talk about them all the time, people think it sort of sounds touchy-feely and things, but the reality is, it's probably the single most clear finding from social science research that far more important than the intervention you use is the relationship between helper and helpee. And in this case, we're talking educator, student. But it is really the only reliable predictor of helping anybody to change anything, all of us adults included as well. And thankfully, it's also the most robust. when people do these fancy, what we call regression analyses to tell what factors predicted what and what was the biggest predictor, it is always the quality of the helping relationship, which, in clinical circles we call the therapeutic alliance. But another way of referring to that is the helping alliance, the working alliance, the collaborative alliance, which it sounds like is exactly what you're seeking out. Who's got that helping alliance with the student? Let's leverage that. And now the other thing that begs, and then I'll stop talking, is the question for me is, why don't the other people? So that person's got a great helping relationship. Why does nobody else in the building have a great helping relationship with this kid? And how can we help people get better at building helping relationships? And the major fundamental, sort of the core of a helping relationship is empathy. It's non-judgmental acceptance and empathy. And we had a little conversation at the break about this. Empathy can actually be taught. You can teach people to get better at empathy. So we can teach more people in a building to get better at building helping relationships.
I think it's also giving staff resources to start those discussions. Whether, we do, circles in our school through restorative practices and some of that work, or now our second step, social emotional learning, giving teachers those tools to start those conversations, to really give them something to work toward and work from.
And I can't leave out, since the discussions about relationships, how much this connects to the work and the initiatives and all the efforts around peer support. Because that's the relationship piece. It's not the Thursday at 4 o'clock, and it's not what is the level of credential. It's recognizing that relationships are diverse, and that sometimes it's having that person who has that similar connection, and empathy is a big part of that, and understanding is a big part of that. And so when we look at how we're diversifying and getting access to services, so much of that is recognizing those relationships. And I've seen amazing work from individuals with lived experience and peer support specialists who have done things that clinicians struggled to do for years. And so it's so important to connect those dots too.
Yeah, and I'll just add, it's one of the reasons we have a sort of a certification program where we teach people our approach, and people, to get them, really good at it, and we can sort of certify they're really good at it. People ask me all the time, they're like, so what degree do you need, to apply to the certification program? Do you need a master's degree, a doctorate? You don't need any degree. You need to prove that you can do this well. Mm-hmm. And anybody can be taught to do it well. And I have found that some of the most powerful change agents in our work are parents without a professional degree who learn this and can do it really, really well and support others in doing it.
Judy, did you have your hand up, or were you just waving?
No, I do. At some point, I just said something.
Okay, I was hoping you were just waving at me, but that was fine. Okay. No, go jump right in.
Excuse me. Well, I was thinking, it could be that speaker has already talked about this, but one of the biggest things that we did, which is also another non-sexy program, is changing the entire structure of how social services are delivered in North Dakota through the counties. And the state has taken over the funding. That also, you will be happy to know from the property tax standpoint, should result in a controlled property tax situation for you too. But the big deal is, and Pam may have already talked about this more, but the big deal is that the goal of this is to make sure that these same services are available to every citizen of this state, no matter where they live. Even if we don't have enough mental health and licensed addiction counselors and all of the other folks we need, there will be a way to do this. So they may not all be delivered the same way, however. And it's going to take a little while to work this all out, but there will be 19 zones made up of multiple counties in which these services will still be delivered locally. But no matter where you live, the ultimate goal here is to make sure every service is available no matter where, just not delivered always in the same way. What I learned in the discussion about this a couple weeks ago is that my home county levies no mills for social services. I am shocked and appalled, as the old line says. And I'm sure it isn't the case that that county has no one who needs those services. However, there is no property tax break if you're levying no mills for it, is there? Anyway, I think that's important. I'm sure you all in this day and a half have been hearing about adverse childhood experiences as well. And I think those people with the relationships that I hear the other professionals here talking about, it's because they may know whether or not a grandparent died, or there's a divorce in the family, or the mother is a substance use sufferer, or whatever that happens to be. They know a little bit more about the background of that student, which enables them to have a connection that the others can't have. Now, you can't all have a perfect connection with every student. I know you're all really busy. But I did want to mention to you that you all have 1 senator, and 2 representatives where you live. I won't ask you to raise your hand if you know who they are. However, I think it would be really important, and I tell this to every group with whom I have a chance to visit, really important for you when you go home to say, hi, I'm Susie Schmatz, and I live in your district, and I'm a teacher or an administrator or whatever your role is. And I just wanted you to know that I'm really happy about this that's happening. We see this as concerns, but I'd like you to know that I would like to be a resource for you. If you have a question about how any of the bills that are being considered in the legislature might affect our school district, send me an email or give me a call and I'll be happy to provide you a little input. I love getting that input. So does every other legislator if they're worth their salt, and almost all of us are. A few I won't invite to Thanksgiving dinner, but that's okay. No names mentioned. But anyway, the point is, do stay in touch. And don't ask them for something right off the bat. Start out by saying, this is the deal. These are the issues that are of concern to me. I just want you to know that I can be a resource for you. And then follow up with an email so that we have your contact information. So that with an email address for you and a phone number for you where you can be reached or a message can be left and you can end up calling later. Please do that, because we like to know, and we rely on that. So we depend on that. I want you to be engaged. So please go home and do that too.
Great advice from Senator Lee, and a great invitation for increased engagement from K through 12 in behavioral health directly with your local legislators. I'm going to go back on the relationship piece. Earlier this morning, we had people stand up that were new today, and a bunch that were here yesterday. If you're new today, I'm going to point to 2 presentations yesterday that were on stage. Everything that we had yesterday and everything today is going to be recorded and delivered in its component, so you don't have to watch the whole day yesterday. You can zero in. One of the great presentations we had from a building leader yesterday was at the beginning of the school year, they literally, on a giant wall of a gym, put the name of every student, and every teacher, administrator, bus driver, and custodial person comes up, and if they have a great relationship, a positive, healthy, helping relationship, they put a yellow Post-it note. If you have a non-healthy relationship with that person, you put a different color note, and then they collect the information. So you get a relationship map for every student at the beginning of the school year, and then they do it mid-year, and then they can identify, because we spent a lot of time today talking about students who were described yesterday as the loud behaviors, the ones that are creating a disturbance. But the quiet kid that's causing no problem for the instructor is the one that may have depression, may have suicidal thoughts. And we also need to build relationships with those students as well. And so I thought that was a great thing. So I'd a pointer to that one. That's online. Go watch that one. The other one was we had a student who was a refugee from Tanzania, ended up in North Dakota, was an ELL, was going through all that. And then now he's at NDSU. He's writing an app. And the app is designed to help teachers better understand the needs and the learning styles of their students. So he's basically trying to create essentially a software app that does much of the same thing, but also incorporates all the specific learning styles that people might have. So there's great process soft tools. There's some specific technology tools that are on the way that are right here in North Dakota. But I would say if relationships are the key, we've got some things that we don't have to wait till 2100. There's tools available today with something as sophisticated as a Post-it note. Thank you, 3M. And we could, and so there's things that could be applied immediately. I'm gonna turn it over to the 3 panelists who are from North Dakota. We have 9 minutes left. We got a world-class best-selling author here. Any one of you have a question for Dr. Ablon?
Oh, pressure's on.
It
My
is.
goodness.
And if not, while you're thinking about your questions, I'm going to throw one out at you, which
Okay.
is, we talked a little earlier, but you get to travel all over the world, you speak, you do whatever. North Dakota, we have a clear thing. We want to be number one at basically everything. But we want to be number one in education for sure. And tell us about other states that are grabbing your work, doing the certifications, making a difference, and maybe tell us the spark, the fire that's happened, and
Right.
who's ahead of us and how are we going to pass them.
Well, and you had asked me earlier, why my interest in North Dakota. and I had said that I think there's a lot that I'm feeling and seeing here that reminds me of the place that sounds like you want to overtake now, which is the state of Oregon, where they have sort of run with our work, and sort of it's just branched off into all areas of human services and education, children all the way up through adulthood. And there it actually started, I think as most things do, with a really small group. It was actually an inpatient psychiatry hospital that heard a presentation and learned our work and was able to eliminate their use of restraint and seclusion in their hospital. And the residential programs that were sending kids to this hospital were like, why are you sending them back to us in 2 days? Because we couldn't control this kid at all. What's happening? And they said, well, we're trying something different. And they started hosting brown bag lunches and inviting people in to sort of learn more. And it spread like crazy. But one of the reasons it spread like crazy in Oregon is if you want to get something done in that state, you need to get like 4 or 5 of the right people in the room, and you can get things done. In New York City, you can't even get 4 or 5 people in the room together. And if you do, they don't generally talk to one another. So I think there's a great opportunity here. And one of the things I'm sensing from everyone here is a collective sense of responsibility for the well-being of children and families. And you know, that's the basis of sort of the motivation to do this work in the first place. So, you know, there are places all over, actually North America, Canada does a lot of work with us, that are good examples of this. But I actually think we're at an interesting time because we've learned so much about what makes for good implementation that actually if you start now and follow best practices of implementation science, you can get there faster than anybody really has at this point.
And one thing I was fascinated this morning when you were talking about the school to prison pipeline, and when we've had an opportunity as a leadership team and cabinet leaders to tour the correction system in North Dakota, we're fortunate. We've got a very progressive leader, Leanne Birch. We're moving in a direction that parallels some of the work that you're doing, but also when we're there, you know, one of the programs is Read Write. We have adults that we're teaching to read who have had a long interaction with the correction system, and somewhere, at some point in their life, they were a first grader or a second grader or a third grader.
That's right.
At some point, they were probably the students that we're talking about right now. And then when they're in our correction system, we're spending $41,000 a year while they're there, and they may not be there for 1 year, they may be 5 years or 10 years. Think of the dollars that we spend versus the $10,000 we spend per student when they're in our K-12 system.
Yeah, and I don't think there's anyone in our correctional systems who we couldn't spot challenges early on in school. And so there's tremendous opportunity there. And it reminds me of, we did work in the state of Maine in their correctional systems. And I remember when I first started working there, I asked them about their recidivism rates. And one of the guys looked at me, he's like, oh yeah, we never say goodbye to anybody. These kids, we say, see you soon. But I will tell you, we worked with them for 5 years. Their 1 year rates of return, recidivism rates, went from just about 60% statewide to 12.5%.
Yeah.
Amazing. But it's really interesting because when you talk to, you know, the interventions were not done by psychologists and things like that. They were done by the correctional officers. And the real shift when you talk to them is they said, hey, look, you know, we could lock people down whenever we want. So anything that's going on here, we can put an end to it. But what they learned is if they're not going to follow these kids around when they leave, what's going to happen in the future? And their whole goal then was, how do we help this person build the skills they're going to need when they leave here, when there's nobody to lock them down if they start to get frustrated later on in life? So, you know, it's proven, it's possible, and it's possible along the continuum of care. And I think the system of care work that you were invoking, that's the answer to this. It's getting all the systems aligned with a common philosophy, common mindset, common process, common language, common goals.
And I think the parallel, and it's fantastic, you've done work across both, you know, correctional, healthcare institutions and school institutions, but what you're really talking about there is using the power differential as a form of control, whether it's in a prison system or a power differential in a school system, doesn't work when the person leaves that Doesn't
Right.
work when they're there, and it definitely doesn't work when they leave and enter an area where that outside the institutional power differential.
Right, we were talking a little bit before this about, I think, we used to believe the power differential induced compliance. In the face of a more powerful person, it induced compliance. What we've learned, since we've learned more about the brain and can image it and things like that, is power differentials don't induce compliance. They induce dissociation. That what happens is people dissociate and just sort of go through the motions to get interactions over with as quickly as possible with authority figures who are exerting power. And we see this all the time in our courtrooms and all kinds of other places, but we see it in our classrooms as well.
You can see it between a teacher and a student, a coach and an athlete, a principal or
Absolutely.
superintendent.
And how many times have teachers had the conversation about a kid about how they need to handle their behavior differently next time, and where the kid says to them, oh yes, absolutely, I agree, and next time I'm going to use my coping skills and all this other nonsense, and there's not a snowball's chance in hell that they're actually going to be able to pull it off, but they're just going through the motions to get this conversation over as soon as possible, because it is so overwhelming to have the conversation. They just want to tune out and move on. We need to reduce the power differential, which is not reducing anybody's position as an authority figure, but reducing the power differential so you have regulated kids that you can work with.
I have one just very quick question. But one of the things that we've really struggled with is separating school safety from behavioral health. And often the conversation is getting very blurred here in the state. And so we talk about safety in schools, and then when things like the shootings and all of this is occurring, there really is to me is a very concerning dialogue. And so just to kind of put that out there, we've talked about who's the enemy when we talk about it from a perspective of safety. And we're combining enemies on the outside with enemies on the inside, and in the end, we're saying, the children with behavioral health issues are part of that. So just any feedback for us as we continue to kind of work through that conversation and that communication on really separating those things.
Right. Well, I talked a little bit earlier about our work with the NYPD and their school safety officers and agents, and it goes right back to what we were talking about 10 minutes ago or something. I actually think what's the best protection we have in our schools? Relationships. And the school safety officers in New York City who are most effective, who are they? They're the ones that have the best relationships. And I was struck, by the way, that some of the kids, the most challenging kids in some of the poorest congressional districts in the U.S. and East New York, their best relationships were actually with the officers and agents, which was amazing. Right? I think we need to break down this artificial divide. Everything we've been talking about is actually intimately related to the safety of our schools.
Well, great place to wrap up, and I want to thank Pam, Dr. Ablon, Russ, Senator Lee. Thank our two keynoters for your presentations this morning. Russ, Senator Lee, thank you for the important work you're doing both on the cutting edge and on the cutting edge of policy. And I want to thank all of you for being here today. And I think, is Tom coming back up?
Actually, Russ is going to talk about the lunch engagement.
Okay, Russ is going to talk.
Yep.
Fantastic. So we're kicking it over to Russ. You can do it
Sure.
from right here. We'll just stay here and listen.
Absolutely. Yeah, we're going to make ourselves available at lunch. Our team will be available if any of you want to visit with them. We'll also have our partners from Sanford here as well to meet and greet and share our resources with you. And at least if you can put some names and faces together, I think that would be great. And what you're going to find this afternoon, I hope you stick around and listen to our panel, because you're going to get to hear from the people that really make our school work. And it's not me. It's the teachers, it's the counselors, it's the people that are with our kids each and every day. So I really encourage you to do that. And we will make ourselves available out here in the Commons area.
Okay, and then Tom, come on up and let us know, tell us about lunch, tell us about when we're reconvening this afternoon.
All right, thanks, Governor. And how about a round of applause for this amazing panel?